In this video, we're going to go over how to set up and use gooseneck snares. You want to refer to the product information related to your specific snares for sizing. When you open the package, you'll see that it comes in 2 rings. This is the inner snare, and this is the delivery catheter. I flushed the delivery catheter with heparinized saline just prior to this to prepare it. You want to take both of these products out of their loops. You can see the snare at the tip of this. This is a gooseneck snare, so it has one opening as a loop at the end. Now here, with the help of one of my fellow countrymen, you can see how this snare gets its name, the gooseneck. At the other end of the snare, you can see the short introducer that allows you to straighten the tip of the snare to allow you to insert it into the catheter. You slide this introducer up toward the tip of the snare, and then as you advance it over the tip of the snare, you can see that the snare collapses and straightens out. Next, you're going to pull out the catheter. You want to use loose loops when you pull this out so that you don't kink it. Now you're going to hold the hub of the catheter and then insert the snare using the short introducer sheath. When the introducer sheath is pressed up into the hub, then start advancing the snare into the catheter. The snare is just slightly longer than the catheter, so you can insert it almost completely. As you approach the end of the snare, you'll notice that it starts to extend past the end of the catheter. Now here you can see the snare is at the tip of the catheter, and as I advance the snare a little bit more, the gooseneck portion of the snare extends out. On the end of the snare you can see this hub that allows for torquing of the snare. You're going to use this to capture whatever you're trying to grab with the snare by rotation, and then you lock the snare by pulling. When you're using this in a patient, you would retract the snare into the catheter and insert it through the sheath up to the target item that you're trying to grab. When you approach it, then you advance the snare slightly so that the gooseneck portion is out, and then with careful attempts you try and wrap the gooseneck around the item, like so. Now what you can see with my right hand, I'm pulling on the snare while giving counter tension on the catheter. This allows you to lock the snare onto the item. You can see as I release the snare, then the item would fall off because there's no longer tension squeezing the snare. In reality, you would keep that tension applied and then remove the entire system altogether until the item is removed.